Osteopathic positional release, also known as strain counter-strain, is a therapeutic technique used in manual therapy and involves placing the affected muscle or joint in a position of minimal tension to increase in quality and quantity of movement. Here is a brief outline of the positional release technique. Assessment. The therapist identifies tender points or areas of muscle tension and discomfort in the patient's body through a full examination including palpation. These tender points can be associated with muscle spasms, trigger points, or areas of increased sensitivity using the visual analog scale, also called VAS score. Positioning. The therapist gently moves the patient's body or affected body part into a position that minimizes tension or strain on the tissues surrounding the tender point. The goal is to find a position where the patient experiences less pain or discomfort, also known as the position of ease. Holding. Once the position of minimal strain is achieved, the therapist holds the patient in that position for a specific duration, usually around 90 seconds to several minutes. During this time, the patient is encouraged to relax and breathe deeply. Release. After the holding period, the therapist slowly returns the patient to a neutral or resting position, allowing the muscles and joints to relax. The transition should be smooth and gentle. Evaluation. The therapist reassesses the tender points or areas of muscle tension to determine if there has been a reduction in pain or discomfort. The patient's feedback is also considered to gauge the effectiveness of the positional release technique. The underlying principle of this osteopathic technique is that by positioning the body or affected area in a position of minimal strain, this will promote an increase in quality and quantity of movement. The technique is believed to affect the proprioceptors, which play a role in regulating muscle tone and pain perception. Positional release can be used as a standalone therapy, or combined with other manual therapy techniques, soft tissue massage, stretching, joint mobilization or manipulation. It is commonly used by physical therapists, chiropractors, osteopaths, and other manual therapy practitioners as part of a comprehensive treatment and exercise rehabilitation plan for musculoskeletal conditions and pain management.